Good afternoon and welcome to our webinar, The Pandemic Effects on FSAs and Dependent Care in 2020 and 2021. Welcome, Happy New Year. My name is Casey Hope. I'm the Director of Marketing and Communications here at MedCom Benefit Solutions. And we are so glad you were able to carve out a little bit of time for us today so that we could help everybody understand a little bit more about what's happening with our employee benefits. I am joined today by Michelle Barkey, as always, our talented and knowledgeable senior legal counsel here at MedCom Benefit Solutions. We are so thankful for her and thankful that she is here to talk us through all of this really confusing stuff. So before we get started, I just want to let everyone know who is on the call that this is being recorded. We are going to be able to send out the recording to everyone who registered, and to the people who are on the call today, we'll be sending out the recording and the slide deck for you guys to use for future reference. We'll talk a little bit this afternoon about what's coming next, what we've got in January for MedCom Benefit Solutions and our webinars that we're trying to do some outreach with you guys. So we'll wrap up with that this afternoon, but I did just want to let you know that this is being recorded and we will be able to send that out to you guys after today's presentation. So without further ado, I'm going to go ahead and turn this over to Michelle Barkey. Michelle?
Thank you, Casey. And today we're going to be talking about several things as far as it relates to the pandemic and FSAs and Decap plans. The first is going to be the Notice 220-29 and 33 that came out in the spring of last year and allowed us to continue benefits or to make some changes under the flexible spending accounts of the Decap plans to the end of 2020. And now that we are still in the pandemic, the Consolidated Appropriations Act of 2021 extended dates and timeframes for certain things. And then we always have to talk about plan documents. And then we want to also talk about things to consider as to whether or not you want to change your plans and whether you want to update your plans. And then we have a couple of scenarios to run by you. And then at the very end, we're going to talk about the Family First Coronavirus Response Act. And this is where we had to, if for employers that were under 499 employees and all public health had to offer, or all public employees had to offer paid time off, and then we expanded the family medical leave. And there's just been a short update with that under the Consolidated Appropriations Act of 2021. So without further ado, let's get going. The IRS Notice 2029 and 33 were very much a welcome relief to a lot of employers in the spring of 2020. Before that, employees, after we started to shut down and they couldn't get in to see their dentists and they couldn't get in to see their vision plan providers, or they couldn't have those elective surgeries that were scheduled, we're really beginning to feel the pinch, especially when it came to the non-calendar year plans. And the non-calendar year plans, you know, they faced that dilemma. It was a use it or lose it. They were coming to the end of the non-calendar year plan. They had surgeries scheduled that were canceled. And then employers were beginning to say, what can we do about this? Is there anything under the law that we could do? And initially there wasn't, although we did indicate that the IRS had said that it would be basically an enforcement year that would be not as robust as normal, and that they would take things into consideration. But then we got Notice 2029, and it said that for those non-calendar year plans, it would allow the unused amounts to be used up until December 31st of 2020. So therefore, even if the plan ended in June of 2020, the funds left over could go until the end of the year. And this was for employers who wanted to do it. It wasn't mandated, it was an option. So, and then they also, under 2020-33, they increased the carryover amount from 500 to 550 from 500. So these were decisions that non-calendar year employers had to make decisions on at the end of the calendar year this year. And so MedCom sent out the notices. What do you want to do? How do you want to handle this? Because everything was optional. And so that was basically what those notices said. The other thing that Notice 22029 said is it also gave the employer to make some mid-year changes to their FSAs. They could make new elections, they could revoke existing elections, or they could decrease or increase the election. So even if you were a calendar year plan and you didn't think you were going to use all the monies that you had elected to take in 2020, and the employer so allowed, you could reduce your elections at that point. So that was basically where everybody was at with the Notice 2020-29. Now, the pending care system was basically the same thing, but unlike FSAs, there were already provisions in the Decap program that already allowed you to make some changes in contributions amounts if you had changes in your daycare throughout the year. So they wanted to make it very, very clear that you could continue to do that and that you could make the changes to the Decap, increase the amount, decrease the amount, or whatever you needed to do throughout the 220 calendar year. And the only difference was with the first was they said unless the plans specifically said they could not make any adjustments. So again, the employers had to decide whether or not they wanted to allow these changes to be made if in their plan document they had originally said that they did not want any changes to be made throughout the year. So Decap was also affected. And then, again, for the Decap, just as we said, you could make new elections, revoke elections, or decrease and increase your elections. We knew a lot of the daycares were closed, schools were closed, after-school programs were shut, so that there was a lot of flexibility in 2020. And then we had the special enrollment rights. Way back in March, I don't know if you remember, but a lot of the carriers were saying, hey, we will allow people to enroll in the plan now if they wanted to change their election. And the question is, under what authority did they have to do that? Under Section 125, where you only have one open enrollment a year, and unless you and your employer qualify for special enrollment right, you just can't change your elections. And the carriers basically said, well, we're not covered by 125. That's the employer health plan, the welfare plan. And we're just saying, hey, we'll open up our open enrollment if they want it. But a lot of the welfare plans were concerned if they would lose their 125 status. There were some changes and some carriers did, some employers did, but a lot did not. Well, when 2029 came down, it said, you know what? You can make these mid-year election changes if you want to allow your employees to do so. You could go through another open enrollment plan. You could allow them to come in and go out whichever way you want. And then they said, and if you did it retroactively, because all those carriers did it in March, you can certainly do that too. The only caution that we gave with this was basically the carriers were saying, we allowed this to happen in March. If you didn't take us up on it, we are not allowing it now. And of course, whenever you make these promises, you've got to make sure that the carrier is up for it. So I don't think there was too much after 2029 came out where on the health plan itself that there was much action because the carriers weren't allowing it. Of course, on the self-funded side, it was easier, but then you had to get it through your reinsurance carrier. And I'm not sure that they were that interested in opening up the enrollment either. So now it brings us to the Consolidated Appropriations Act that was signed in the end of December. This also kept our government running for another period of time. But basically what we realized is that COVID is still going on and we are still reeling from the effects. While in some states we are more open than other states, in some states where you might be able to get treatment and you might be able to go to the dentist and you might be able to have that elective surgeries, Other states are still locked down and they could not access some of these services. And then we also have to look at the individuals who are afraid to go to the doctors, the dentists, the vision places, or they're afraid to get their elective surgeries because COVID is alive and well and still out there. So the government said, okay, let's just take a look at this once and for all. We are going to make it really easy, and we're going to say this is for everyone. So they said you can carry over unused FSA balances from plan years ending in 2020 to the plan year that ends in 2021. So if you're a calendar year plan, any amounts that you have left over in 2020, you can carry it over to December 31st, 2021. And that's provided you have a carryover provision in your contract. If you're a plan that ended in June of 2020 and you had already elected to allow your employees to use the unused amounts into December under the 2029, that's fine, but we're still in COVID. So now you can roll it over to the end of your plan year, which is basically May 31st if it was a June start date. So that's how it worked for the carryovers. Same thing for grace periods. They said, you know what? For grace periods, if you don't have a carryover, instead of having a grace period that is 2.5 months, your grace period can now be 12 months. So it basically allowed all that monies to roll over again or to be used just like it did with the carryover amounts. So you can now extend your grace period to 12 months. And then, you know, those participants who might have terminated in 2020, they can continue to receive reimbursements throughout the end of the plan year. And this is, all of these provisions are if the employer so desires. It is an employer decision. They can allow one, they don't have to allow the other. But again, it is up to the employer to decide what they want to do. And then with this allowing the terminated employees to continue to receive the monies to the end of the plan year, the employer gets to make one more decision in this. They get to decide whether, if they want to allow this, it would only be for the amounts that they underspent with their contributions, or if it's the full elected amount. The government did realize that some employers want to do something for their employees and they don't want their employees to lose anything, while also understanding that the employers also had a tough time this year. And COVID has affected all businesses in all walks of life. So maybe they don't want to be able to give the full election amount, especially if the employee terminated early in the plan year, but they did want to go up to the contribution amount. So the employer has that decision to make as well. And then, you know, one of the things that happened with the Decap is that we did have some children who were 13 and aged out. And the government said that for those children that aged out during that pandemic, it would go to the age of 14. So that does help a little bit. Now, again, we want to make it very, very clear that all these are up to the employer. They're all permitted election changes. Nothing is mandatory. And then participating that the COVID is going to continue into 2021. And we're going to end up with the same thing part of this year, if not all of this year. The government said, you know, we're going to make it clear right from the start now in 2021. We can make the carryovers can go into 2022. And the grace periods can be extended to 12 months. And from 2021, that would go to the end of the plan year in 2022. They also said that permits participants who terminated in 2021 to continue receiving reimbursements of unused money through the end of the plan year. And again, the employer gets to decide if it's contribution amount or full election amount. And again, the maximum age for Decap will be 14. So we have whatever happened in 2020 where we can carry over to 2021, and 2021 we can now carry over to 2022. I'll tell you one of the things that MedCom did. We had already gone through our open enrollment for 2020, for 2021. But when this came out the end of December, we reopened our open enrollment and gave everybody else the opportunity to see whether or not they wanted to increase their amounts, knowing that we were going to say it wasn't a use it or lose it year, that we were going to roll over the full amount into 2022. So for those that were planning something but just weren't sure whether it was going to go through, we wanted to give everybody the opportunity to say, okay, we're going to run through open enrollment again. And they also said that we will be able to have prospective modification of election amounts for health plans and Dcaps in 2021. So potentially moving forward, you can also modify the amounts of the health plans or what people are putting into these benefits throughout the year. And again, everything was done to help the employer, help the employee. It is all permitted election changes. Nothing is mandatory. But then it all comes down to what do you do with your plan documents, and can you go retroactive? What can you do? So the government stated that, yes, you must adopt plan amendments if they were permitted changes. And in plan years 2020, you have until December 31st of 2021 to amend the documents, and plans ending in 2021 have until December 31st, 2022 to amend the documents. So it does give us some time moving forward to amend the documents. You could even make a retro change if you want to, knowing that you're not amending your documents, then have that retro change go through. But it's just a question of moving forward. What do you want your employees to know about this? And what do you want to be able to do? So that's basically the way it is. Again, in 2020, what we did at the end, we have a calendar year plan at MedCom. So for 2020, we ran a report and we found out that we had 4 or 5 employees who hadn't spent the money up to the carryover amount that was more than the $550 that we had. So then we opened it up and said, we don't want anybody to lose the money. So since they had contributed it all at the end of the year, then we went ahead and we said that they could roll over it, the carryover, the full amount into 2021. So employers have a lot of decisions to make. They don't have to make a rush judgment. Again, just look to see what you want to do. So things to consider. Again, do you live in the state that has certain degrees of lockdowns? Do you have an older employee population that might be nervous to get out, or even a population that might have some sick people? What did it look like in 2020 at the end of the plan year? Do you have monies that are still out there? And you want to be able to, potentially let your employees use it? Is the plan a calendar year plan? Because we already looked at it for non-calendar year plans, but you can go back for non-calendar year plans and look at it again. And then how is your TPA going to handle it? Talk to your TPA about whether there'll be additional fees or how that will handle. And do you want to change anything for 220 now and wait and see before making a decision in 2021? Especially if you're a calendar year plan, you want to rock and roll and see if most of the monies are spent by the end of 2021 before making that decision. So you've got some options here. But again, look at the states that are really, really hard hit with lockdowns, and if the employees contributed with the understanding that they were probably going to get to see the physicians this year. It just gives us a lot of options. So possible scenarios that have come up so far, and I want to give you 2 that we found to be absolutely incredible questions that people asked. And they said an employer adopts both the carryover provision from 2021 and the provision that terminated employees can use the funds to the end of the plan year. And then they said, can the terminated employees carry over the funds into the next plan year after that? And in this case, we concluded that there would be no carryover into the next plan year if the employer adopted both provisions. In short, at termination, there is no triggering event that resulted in a loss of coverage, and therefore COBRA is not an option. Also, the CAA 21 only allowed additional time for grace periods and not for carryovers for terminated employees to the next plan year. So they said they could carry it over until the end of the plan year. The next scenario was an employer chose the option to allow carryovers of leftover funds from 2021, but did not allow terminated employees to use the funds. The employee terminated and they were underspent, so they elected COBRA. COBRA premiums were calculated to the end of 2020, and the employee elected. The employee had funds left over. Do they get to incur expenses to the end of 2021? Or only to the end of 18 months of COBRA eligibility with a calendar year? And this answer is it depends. The CAA would probably allow it to go to the end of the next plan year, as it would for all other employees. However, IRS guidance also states that health FSAs allowing carryovers for non-COBRA beneficiaries must also allow for similarly situated beneficiaries, subject to the same terms, but there was a special limitation that they did not have to go over that 18 months. So in this stage of the game, I think the employer would really get to decide whether or not they would allow it beyond that 18 months. And then to talk a little bit about the Family First Coronavirus Response Act. And it allowed for, and this came out, I believe around April or May of last year. This year has run together so quickly, it's hard to know, to remember exactly. But it called for paid sick leave for up to 2 weeks, 80 hours at 100% of the salaries for those employers that were under 500 and for all public employees. It mandated that the employee is unable to work even remotely due to a quarantine order from a federal or state organization, or that they're unable to work even remotely due to COVID symptoms for which the employee is seeking a diagnosis. And then they also expanded family medical leave if the individual had a child that the school or the daycare was closed. So those are the two things that the Family First Coronavirus Response Act actually allowed. And again, this is where it was originally set to expire in December of 2020. And again, if you remember with the Family First Coronavirus Response Act, employers got tax credits. So the employer was not losing anything. And the government said, you know what, we will continue those tax credits and the employers may extend this to March 31st, and they will still get their tax credit, but it is the employer's choice. In 2020, it was mandated. Now it's the employer's choice through March 31st. Why didn't they mandate it again? Well, it was very simple. The Family First Coronavirus Response Act is a law, and they would have to get through Congress and they would have to make that change by law. We know that Congress might not be able to do that very quickly. So what they could do quickly is that the agencies, the Department of Labor and the Treasury, decided that they would allow for it to be extended and they didn't have to go back to Congress in order to do that. But they also said that if you do this, it's not giving anybody any additional benefit in 2021. So if they already used their 10 weeks of 2 weeks of paid sick leave in 2020, they would not get an additional 2 weeks in 2021. And if they already used their extended family medical leave, they would not get extended family medical leave in the 10 weeks in 2021. But if they hadn't used it and the employer wants to extend it, it can be extended through March 31st. And then we always recommend that if you do this, you consider notifying your employees that this is still out there. So there has been a lot of changes. And again, they all kind of follow through 2029 and the Consolidated Appropriations Act is just kind of an extension of what we already had with a little bit more, making it a little bit more simplified. And it moves on until 2022 if the employer so desires. Casey, do we have any questions?
We do, Michelle. Just a few questions right now. I have a feeling that a few more might come in. This first question is a three-part question. We may have talked about it briefly, but I definitely think it is something worth going over. So the first part of this question, Michelle, could the provision allowing post-termination continuing FSA coverage be applied retroactively?
Yes, it can. It can go to the end of the plan year. So yes, the government expected that there would be some retroactive. They just came out with the law now, so that if you had an employee that terminated in March, you can now extend it to the end of the plan year, which might be, the next year. So yes, it's not really a retro. It's just a question of you allowing a continuation through the next plan year. But yes, you can do that.
Okay, and then another part of this question is, how does that work with the prohibition on retroactive elections under Section 125?
It's not really a retroactive, because basically what you're saying is that as of now, you're extending the provision to allow them to use their funds until the end of the plan year in 2021. So the decision is made now to extend into 2021. And it might affect some employees that terminated prior to that. But the actual provision you're allowing is now. So you can go ahead and do that.
That makes sense. Thanks, Michelle. And another part of this, what if COBRA was already offered or coverage had already terminated?
If COBRA was already offered and terminated, then I don't believe that they would be entitled. They probably already used the unused amount. So that's just the way that would end up. But it's a good question.
Yeah, absolutely. Our next question here, if an employer provided the mandated paid leave, but did not take the payroll tax credits in 2020, can those be offset on payroll tax credits before March 31st, 2021 for those employees? Just a note on this employer, the fiscal tax year is July to June. So the tax years would not be crossed.
If the tax years are not crossed, then I would say, yes, you could probably do it. But let me do a little bit more research on that question.
Absolutely. I think that's reasonable there. That's a tough question. Going back to the first set of questions here, Michelle, the post-termination provision is available for 2020. So how could it not be considered retroactive if an employer chose to adopt it for 2020?
Because what they're adopting in 2020 is to the end of the plan year in 2020. And it would allow it to, and again, if it's a calendar year plan or whatever in 2020, they could go to the end of the plan year in 2020. And you're adopting it now that would allow for the plan year 2020.
And what if that terminated employee did not use their funds?
If the terminated employee did not use their funds, again, it's up to the employer as to whether or not they want to allow them to continue to the end of the plan year, whatever the plan year is. And that's a retroactive, that's a change that the employer is making due to this new law. Again, if they didn't use their funds at the end of the plan year, that's it. They don't have any more. That's the full extension for the terminated employees.
I gotcha. That makes sense. I'm going to give just a few more moments for anybody to submit any last minute questions. Of course, we will be providing this as a recording and the slide deck as soon as it's able to process through. So we'll get that out to you as soon as possible. Just want to go ahead and remind everyone about some additional solutions for MedCom Benefit Solutions. As you know, if you are a part of our webinars or if you follow us on social media on LinkedIn, we do offer ACA employer reporting and penalty appeal support, consumer-driven health plan, and COBRA premium billing administration. We have so many solutions for health and welfare compliance and actuarial solutions and HIPAA privacy and security solutions. So, I mean, really, we have everything you need here at MedCom Benefit Solutions. Looking ahead for the rest of this month, here's our presentation calendar. We had our Understanding the Consolidated Appropriations Act of 2021 was on demand up through today, but you can still find it on our YouTube channel. Just search for MedCom Benefit Solutions and you can find a whole slew of all of our webinars and trainings there. Compliance Recharge with Derek Ashton is back on Wednesday afternoons at 3 o'clock. His next is going to be discussing wrap documents tomorrow at 3. And then next Thursday on the 28th, Michelle and I will be back to talk a little bit more about the pandemic and effects on COBRA in 2020 and 2021. So those scenarios that we talked about, earlier that has to do with COBRA, we're going to do a deeper dive there. So I will be sure and send out that registration link, but you can always find it on our LinkedIn MedCom Benefit Solutions page where you can register for that webinar. Just a couple more questions here. Says, we're still talking about that first set of questions about retroactively and terminations. It said, are we saying that because the 2020 plan year is over, an employer really can't make any changes at this point that would affect a terminated employee in 2020? Is that what we're saying?
No, we're not saying that at all. Don't forget they have up until December 31st of 2021 to make plan changes that affect 2020. So there is a way to do it. You can make the plan changes. You don't have to make this really, really complicated where, you know, well, the government's just told us this and now I can't make the changes. The government wanted it to be able to be changed. They wanted it to be as easy as possible for employers to make those changes, even for terminated employees. They didn't come out with the law until December the 28th. So they will expect that there will be some carryover into 2020 when you're making those changes. The plan documents will be reflected accordingly, but the plan documents don't have to be decided until December 31st of 2021. And there are ways to make the plan document, make those changes that would be affected. So again, the law just came out. They wouldn't have mentioned the terminated employees in 2020 if they had it intended for them to be able to continue it to the end of the plan year, knowing that a lot of this information came out very late in the year 2020.
Thank you, Michelle. And to those that are out there that submitted questions, if you have any lingering questions, if you have still some things that aren't fully answered, Michelle's contact information is here on the screen. Feel free to give her a call or shoot her an email, and she'll try to walk you through the steps. We're here as much as we possibly can be to make this easier for you guys to understand, and to all try to work through it together. So also, we'll be sending out the recording and the slide deck and the registration for our next Thursday webinar that will also be at 2 p.m. where we talk a little bit more about COBRA. So we have one more question, or a couple more questions actually that just came in. Michelle, it said, would we be making changes to what ended in 12/31/2020? Or are we making changes to our 2021 plan to allow for 2020 carryover or plan overages?
You know, that's a very good question, and it's something that I'll have to look into. So I'm not going to give you an answer on that one today, but okay. We will be looking at that.
All right, absolutely. And for the person who asked that question, feel free to reach out to Michelle, but we'll definitely look into that and get an answer to you. If active employees are not able to make changes to the Dcap during the plan year because the company was not working, but employees were still being paid, could employees, when returning to work, make a change retroactively, therefore running those elections back through payroll? And just to note, Michelle, this one is If don't have to answer this now. If it's something that we need to research a little bit, we can always get back to this.
Yeah, I don't want to say they can do that because you usually cannot make retroactive changes. But again, I want to, as far as that one was concerned, the Dcap, because they could have all along throughout the year 2020. But let me take a little bit more of a look at that exact question and see what we can come up with. I know they can carry over the amounts. So that's probably the solution, is to carry over.
All right, excellent. So we will get this information out to everybody as soon as possible. And we will be back with you, Michelle and myself, next Thursday at 2 p.m. to talk a little bit more about COBRA and what it means for 2020 and 2021. So thank you guys so much for being with us and giving us your time. And we hope to hear back from you soon and to talk with you again next week. Michelle, thank you so much for your expertise and information. I appreciate it so much.
Okay, thank you, Casey.